What if I told you that avoiding self-pleasure in your later years doesn't just mean missing out on pleasure? It can actually accelerate discomfort, dryness, loss of sensitivity, and even harm your overall vitality. Most women over 60 never hear this warning because for decades, no one dared to talk about it openly. But I've seen it again and again in my own practice. Women who stop touching themselves often begin to experience changes they mistake for just aging, when in reality, it's their body quietly shutting down from neglect. I'm Dr. Lisa Perriera, a gynecologist with more than 30 years of experience caring for women through menopause and beyond. And today, I want to share something that may surprise you. Self-pleasure in old age is not optional. It's not embarrassing, and it's not just for pleasure. It is a key part of keeping your body healthy, your circulation alive, and your confidence strong. And if you ignore it, your body will let you know in ways you might already be feeling. Think of your body like a house. If a room is closed off and never used, the air grows stale, the walls collect dust, and eventually the room feels lifeless. Your intimate area works the same way. Without touch, without stimulation, circulation decreases tissues, dry muscles weaken, and sensitivity fades. And when that happens, many women start to notice painful intimacy, more bladder problems, restless sleep, and even a decline in mood. Let me give you an example. Margaret, a 70-year-old patient of mine, confessed that she hadn't touched herself in over 20 years. She believed it was inappropriate at her age. When she came to see me, she was dealing with severe dryness, discomfort, and a constant sense of fatigue. She thought it was just part of aging, but the truth was her body was suffering from disuse. Once she began a gentle routine of self-stimulation paired with some simple lifestyle changes, her tissues softened, her sleep improved, and she said, "Dr. Perriera, I feel alive in my own body again." And Margaret isn't alone. I've met countless women who wish someone had warned them earlier that ignoring self-pleasure has consequences. According to the Cleveland Clinic, sexual activity, whether alone or with a partner, keeps blood flow active, supports the pelvic floor, reduces stress, and improves quality of life. Without it, the opposite happens. Muscles weaken tissues, thin sensitivity declines, and emotional well-being suffers. Now here's the important part. I don't share this to frighten you, but to empower you. Because while the risks of neglect are real, the solution is beautifully simple. Self-pleasure is free, safe, natural, and belongs only to you. And even if it's been years since you've allowed yourself to explore it, your body can still respond. So in today's video, I'll reveal exactly what happens if you don't masturbate in old age, why those changes occur, and most importantly, how you can reverse them. You'll learn the 3 biggest consequences of avoiding self-pleasure and the gentle, science-backed practices you can start today to protect your body, your sleep, and your confidence. But before we dive deeper, I'd love to hear from you. Be honest with yourself. When was the last time you thought of self-pleasure, not as a secret or shameful act, but as real self-care? Share your thoughts in the comments. I promise you're not alone. When women tell me they've avoided masturbation for years, I gently explain, it's not just about missing a private moment of pleasure. It's about what happens to the body when a vital system goes unused. After menopause, estrogen levels drop, and your body relies even more on circulation and stimulation to keep tissues healthy. Without it, 3 major consequences appear, sometimes slowly, sometimes all at once. Consequence 1: vaginal dryness and thinning tissues. After 60, many women begin to notice that intimacy feels uncomfortable, or that everyday activities like walking or sitting too long cause irritation. This isn't just age, it's lack of blood flow. When you stimulate yourself, blood circulates through the pelvic area, carrying oxygen and nutrients that keep tissues soft and elastic. Without that, circulation tissues grow thin, dry, and fragile. The Cleveland Clinic notes that regular sexual activity, even alone, helps maintain elasticity and lubrication. Ignoring it means the body forgets how to stay supple. One of my patients, Elaine, 68, told me she thought painful intimacy was simply her new normal. Once she reintroduced gentle self-pleasure, she was stunned at how her comfort improved. Consequence 2. Weaker pelvic floor and bladder control. You might not realize this, but the contractions that happen during orgasm are a natural workout for the pelvic floor, the muscles that support your bladder, uterus, and bowel. When these muscles are ignored, they weaken. The result? More frequent leaks, less core stability, and even changes in posture. According to the NIH, strengthening the pelvic floor reduces urinary incontinence by up to 70%. Masturbation is one way to engage those muscles naturally. Without it, many women find themselves embarrassed by bladder leaks they thought were unavoidable. Consequence 3. Decline in mood, sleep, and overall vitality. Here's something rarely discussed. Self-pleasure isn't just physical, it's neurological. When you stimulate your body, it releases endorphins and oxytocin, the natural chemicals that reduce stress and promote relaxation. Skip this entirely, and your nervous system loses an easy, drug-free way to regulate itself. Many women over 60 who avoid masturbation struggle with restless sleep, higher stress, or a dull mood. One of my patients, Ruth, 72, told me she used to lie awake until 3 a.m., her mind racing. She'd never considered that her body needed the calming hormones that release during orgasm. Once she tried, her sleep improved within weeks. Put together, these 3 consequences, dryness, muscle, weakness, and lower mood, can create a cycle. Intimacy becomes painful. Leaks create embarrassment, fatigue increases, and self-confidence drops. Too often, women believe this is just aging, but in reality, it's the body's response to being ignored in a vital area of self-care. Now here's the hopeful part. None of these changes are irreversible. Your body is resilient. With the right practices, gentle self-stimulation, pelvic floor exercises, proper hydration and nutrition, you can restore comfort, strengthen muscles, and even improve your sleep and mood. In the next part, I'll share how masturbation after 60 actually works in your favor. I'll explain the proven health benefits that science supports and how a simple, consistent routine can help you feel more comfortable, more energetic, and more alive. But first, I'd like to ask you of the 3 consequences we discussed: dryness, weak bladder control, or restless sleep. Which one do you think affects women the most after 60? Share your answer in the comments. You may find you're not alone. Now that we've talked about what can happen if you completely ignore self-pleasure after 60, let's shift to the hopeful side of the story. Because here's the truth, your body doesn't lose its ability to respond. Even after menopause, even after years of silence, stimulation can reignite circulation, rebuild comfort, and restore vitality. Science, patient stories, and decades of experience all show that masturbation after 60 carries profound benefits far beyond what most women imagine. Benefit 1: healthier circulation and comfort. Every time you stimulate yourself, blood flow increases in the pelvic region. This circulation carries oxygen and nutrients, keeping tissues flexible and reducing dryness. According to the Cleveland Clinic, women who maintain some form of sexual activity, even alone, report less discomfort and greater elasticity in their vaginal tissues. Think of it like watering a garden. When the soil is nourished, plants flourish. Without water, they wilt. Self-pleasure is that water for your intimate health. Benefit 2. Natural stress relief. Masturbation triggers the release of endorphins, your body's built-in feel-good chemicals, as well as oxytocin, sometimes called the bonding hormone. Together, they calm your nervous system, lower stress hormones, and ease anxiety. The Mayo Clinic highlights how orgasm reduces cortisol, the stress hormone linked to belly fat, restless sleep, and high blood pressure. One of my patients, Carol, 67, told me she began using gentle self-stimulation after stressful days, and she called it her free therapy session. Benefit 3. Better, deeper sleep. Insomnia is one of the most common complaints I hear from women over 60. Self-pleasure can be a natural sleep aid. The hormonal shifts that happen during orgasm relax your muscles, slow your heart rate, and make it easier to drift into restorative sleep. A 70-year-old patient of mine, Diane, admitted she hadn't slept through the night in years. After embracing self-pleasure before bed, she came back and said, "Dr. Perriera, I finally wake up, rested instead of exhausted." Benefit 4. Preserved sensitivity and intimacy. Without regular stimulation, nerve endings in the pelvic area become less responsive. Over time, women may feel numb or disconnected. Masturbation helps keep those pathways alive, preserving sensitivity. And here's something many women are surprised by. Self-pleasure often enhances intimacy with a partner. By knowing what feels good on your own, you can communicate better, reduce anxiety, and bring more confidence to your relationship. One of my married patients in her late 60s told me, "Rediscovering my own body gave me the courage to reconnect with my husband. It changed everything between us." Benefit 5. A stronger pelvic floor. Orgasms aren't just pleasurable, they're exercise. The natural contractions strengthen the pelvic floor, which supports your bladder, uterus, and bowels. The NIH reports that regular pelvic floor activation reduces urinary leaks and improves core strength. For women over 60, this is critical. Evelyn, age 71, confessed she was embarrassed by frequent bladder leaks on walks with friends. After combining pelvic floor exercises with gentle self-pleasure, she proudly told me, "I don't live in fear of accidents anymore. I feel in control again." Put these together: better circulation, less stress, deeper sleep, preserved sensitivity, and stronger muscles, and you see why masturbation after 60 is not indulgence, but prevention. It's not just about a moment of release. It's about fueling your body with natural medicine that costs nothing, carries no side effects, and belongs entirely to you. Now, you may be wondering, Dr. Perriera, how do I start if it's been years or if I've never allowed myself before? That's exactly what we'll talk about in the next part. I'll guide you through safe, comfortable ways to begin how to avoid discomfort and how to make it a gentle part of your wellness routine. But before we go there, I'd love to ask which of these 5 benefits feels most important for you right now. Better sleep, less stress, improved intimacy, stronger muscles, or simple daily comfort? Leave me a comment below. Your answer might help another woman realize she's not alone. I want to share the story of Helen, a 72-year-old grandmother who sat across from me one afternoon with tears in her eyes. "Dr. Perriera," she said quietly, "I feel invisible in my own body. I haven't felt alive down there in decades. I just assumed it was over for me." For years, Helen had lived with discomfort, bladder leaks, restless nights, and a dull sense of disconnect from herself. She had been told by friends, and even hinted at by her family, that intimacy after a certain age was simply irrelevant. But when we talked, I explained that ignoring her own body was like closing the door to a room in her home. "Helen," I said, "imagine a beautiful room in your house that you lock up and never use. At first, it just collects dust. Then the air grows stale, the light fades, and the room seems lifeless. But the truth is, the room was never broken. It was waiting for you to open the door again. That room, I told her, is her intimate self. Helen looked doubtful, but she agreed to try. She began gently, just a few minutes of self-stimulation a couple of times a week, paired with simple breathing exercises. Slowly, her body responded. At her follow-up visit, 2 months later, she sat straighter in her chair, a spark in her eyes. "Dr. Perriera," she whispered, "I sleep through the night. I don't dread intimacy anymore. And most of all, I feel like my body belongs to me again." Her story is powerful because it shows that the body doesn't forget it waits. Even after years of silence, even after decades of shame, your body can still awaken. The nervous system remembers. The tissues respond. The muscles strengthen. The light in the locked room turns back on. Another woman, Patricia, 69, widowed for nearly a decade, once told me she thought intimacy died with her husband. But when she allowed herself to explore masturbation without guilt, she said it was like finding a forgotten part of myself. For her, it wasn't just about pleasure. It was about independence, self-confidence, and knowing that her well-being didn't depend on anyone else's permission. And this is the analogy I want you to carry with you. Your body is not an abandoned house. It is a living, breathing home. When you close off a room, the air grows stale. But when you open the door, let in fresh air and switch on the light, the whole house feels different. Self-pleasure is opening that door. It brings circulation, warmth, and life back to a part of yourself that was never truly gone. I know for many women, even talking about this feels bold, maybe even uncomfortable. But remember, boldness is exactly what keeps us growing, even in our 60s, 70s, and beyond. Helen's courage to open that door transformed her daily life, and yours can too. So if you've been avoiding yourself out of habit, shame, or silence, let this be your reminder your body is still yours. It still longs for connection, touch, and care. And you are never too old to give yourself that gift. In the final part of this video, I'll recap everything we've covered, the risks of ignoring self-pleasure, the benefits of embracing it, and the simple first steps you can take to start safely and comfortably. And I'll leave you with one hopeful message that no matter your age, vitality is still possible if you are willing to turn the key and open the door. But before we go, let me ask you if you could unlock one part of your life again, better, sleep, more comfort, less worry, or simply a feeling of aliveness. What would you choose first? Share it with me in the comments. We've come full circle in today's conversation, and I want to pause with you for a moment to reflect on what we've uncovered together. We began with a difficult truth, ignoring self-pleasure. After 60 doesn't just mean missing out on intimacy. It can lead to dryness, weaker pelvic muscles, restless nights, and a sense of fading connection with your own body. Too many women mistake these changes for just aging, when in fact they are signs of neglect, signs that your body is quietly asking for care. Then we explored the other side, the powerful benefits that come when you embrace self-pleasure as a form of self-care. From healthier circulation, to reduced stress, from deeper sleep, to preserved sensitivity, and even stronger pelvic floor muscles. The science is clear. Masturbation after menopause is not shameful. It is medicine. It is prevention. It is vitality. And we heard the stories. Helen, who unlocked a room in her body she thought was closed forever. Patricia, who discovered independence and confidence through self-care. These women are living proof that it's never too late to reclaim your body and your energy. So what does this mean for you? It means that your body is still alive, still responsive, still deserving of attention. If you've been carrying the weight of old taboos, I want you to know you are not alone. And you are not too late. Whether you've avoided self-pleasure for decades, or you've simply never thought of it as essential, you can begin today. Here's my invitation tonight. Find a quiet moment. Let go of guilt. Breathe deeply. Begin gently. Notice how your body responds, not with judgment, but with curiosity and compassion. Remember, there's no right or wrong way. This is about reconnecting with yourself in the way that feels best to you. If this message resonated with you, I encourage you to share this video with a friend, a sister, or a loved one who might also benefit from hearing it. Too many women over 60 are still living in silence, thinking their bodies are finished. Together, we can change that conversation. And don't forget to subscribe to this channel, Elder Care Wellness, for more evidence-based guidance from me, Dr. Lisa Perriera. Every week, I share practical, science-backed solutions to help women over 60 age with confidence, energy, and joy. Now, I'd love to hear from you. Which part of today's video struck you the most? The risks of ignoring self-pleasure, the surprising benefits, or the stories of women who reclaimed their vitality? Leave your answer in the comments. Your voice could inspire another woman to take her first brave step. And before we close, let me remind you, this video is for educational purposes only. It does not replace medical advice. Every woman's body is unique. If you are experiencing pain, significant changes, or have personal concerns, please consult with your healthcare provider. Your well-being deserves personalized care.